Health is wealth is a saying that we all know. But what does it truly mean when the very foundation of healthcare is out of reach? The truth is, health only becomes wealth when the right systems are in place, when hospitals are equipped, professionals are available, and every citizen, regardless of status, can access the care they need to recover, thrive, and live well. In Delta State, this truth is not just understood, it is being acted upon. Under the visionary leadership of Governor Sheriff Oborevwori, the state is witnessing a quiet revolution in healthcare. Guided by his more agenda, his administration is not just making promises, it is delivering results, building modern health facilities, ensuring affordable care, and extending services to even the most remote communities. This is not just a story about policies, it is about people. It is about hope restored, lives saved, and a government truly walking the talk. In Delta State, the health sector has a transformative story where well-being is no longer a privilege but a right. The young and vibrant Delta State Commissioner for Health, Dr. Joseph Onojaime, is at the helm of affairs at the Ministry of Health, on whose shoulders the implementation of the policies and programs of Governor Sheriff Oborevwori's more agenda solely rests, to ensure Deltans get the benefits of accessible, affordable, and reliable healthcare services irrespective of status, gender, religion, and any other bias.
Of His Excellency, Right Honorable Elder Sheriff F.O. Oborevwori has made in the health sector in the last 2 years are enormous. The method we are operating give the hospital leverage to maintain itself, like revolving funds. To maintain itself, you generate, you spend 100% for yourself, and we are maintaining this. We made this on ground, and we are maintaining it, and it's very, very good. As I'm talking to you, His Excellency has supported the general, the teaching hospitals, and the primary healthcare facilities with a lot of medical equipment, ranging from hospital bed, theater bed, patient monitor, incubators, and too numerous to mention.
With 4 tertiary health facilities, namely Delta State University Teaching Hospital, Del South Ogara, Asaba Specialist Hospital, Asaba, Mother and Child Hospital, Owalero, and the Central Hospital, Warri, 65 secondary healthcare facilities, and 446 primary healthcare centers spread across the 25 local government areas of the state. Indeed, Delta no dey carry last. These tertiary, secondary institutions and primary healthcare centers are not just buildings, but structures with well-trained manpower personnel, equipment, and serene environments that enhances healing of the sick. Delta also boasts of various health institutions for the training of health personnel like nurses and other support services to meet with the demands of manpower. The state has 5 schools of nursing and midwifery in different parts of the state. The School of Nursing Warri, Sapele Abo Eku, and the School of Midwifery, Okbanam, as well as the School of Health Technology, Ufoma Ogeli North Local Government Area. Within the last 2 years, how has the Oborevwori administration tackled the challenges in the health sector? Currently, the Oborevwori administration is remodeling and carrying out repairs as well as expansion on over 150 primary healthcare centers in the state.
On the issue of infrastructure, where we are currently renovating 150 health center across the state, capturing all senatorial and all local government areas, minimum of 4 that is going around the state.
The construction of a new general hospital in Orerukpe, in Okpe local government area, The project has reached an advanced stage, thus giving hope to the people for better and more health services. The College of Health Technology Ofrode in Isoko North is another milestone in the health sector. The project is nearing completion. Being a women and a children-friendly governor, Governor Sheriff Oborevwori has continued to fund the free under-5 treatment and maternal health care for pregnant women. This is to ensure that those within this bracket get quality healthcare services free of charge. The result of this is obvious with an improved health indices for Delta State. The Delta State Contributory Health Scheme, no doubt, has made critics maintain sealed lips. This scheme, with over 2 million enrollees, particularly civil servants and from the private sector, has made the state to have a healthy and productive workforce as families access free Medicare and drugs just at their fingertips.
The contributory health scheme is doing very well. We have over 2 million enrollees, and you know that the children under the age of 5, they are a vulnerable group, and pregnant women are also a very vulnerable group. That burden is being taken away by the state government. You know, their treatment is 100% free, and the state government is doing a lot in that regard. So for the formal sector, which are those that are working under the state government, they normally get their care. We are doing a lot of monitoring in that regard. They have contributory officers in all the hospitals that help to monitor the progress.
With the huge investments in healthcare equipment and services by the Oborevwori administration, the trend of medical tourism to other climes for healthcare services is being curbed. On immunization, the state has maintained a steady lead with collaboration with the federal government and other partners.
The relationship between the state and partner is very cordial. We work in synergy to improve the health indices of the state. We don't work at cross purpose. We work together. We compare notes and all of that. And when we do that, we get the best outcome for our people.
The primary health care is dear to the heart of Governor Sheriff Oborevwori administration. Hence, over 150 is currently undergoing renovation, expansion, and manpower development. At the Primary Healthcare Center in Warri South, the center is well furnished with modern equipment to meet the health needs of the grassroots people. The center has modern male and female wards, labor room, theater, and laboratory, as well as treatment room. Healthcare is indeed closer to the people. Let's go for a ride to some hospitals across the 3 senatorial districts to see what's on ground and their effect on the health needs of the people in line with the MORE agenda. The Asaba Specialist Hospital, ASH, is one of the tertiary hospitals in the state that witnesses high traffic of patients and others for their health needs. The Chief Medical Director, Dr. Peace Igosewe, a consultant pediatrician, gives kudos to the governor for his interest in ensuring the health facilities get the desired attention to be able to meet up with its mandate in providing efficient, reliable, affordable, and accessible health services.
With his support, we have been able to achieve accreditation for residency in various faculties, and today the hospital is a teaching hospital. We have an MOU with Novena University that enables us to train medical students, and we have accreditation with the Medical and Dental Council of Nigeria. All of this has been made possible through the support financially and otherwise that we've enjoyed from the state government.
The Asaba Specialist Hospital certainly has lived up to expectations with the volume of patients who troop into the health facility daily for Medicare, where new innovation is trailing healthcare services delivery.
Aside from the funding for several projects that we have enjoyed, The resident doctors in the hospital have also received their medical residency training fund, which is money paid to every doctor who is undergoing residency of about ₦1 million yearly. So we got approval for all of our resident doctors, and they are getting that money yearly. And this came after he became the governor of the state. Also, recently we have received, thankfully, several dialysis machines graciously provided by the state government, and he has enabled us to at least have a dialysis center that can cater to patients with chronic kidney disease, and they can have affordable dialysis within the locality of Asaba without having to go as far as Onitsha, which it used to be before. This has greatly eased the pressure on our patients. Also, under the administration of the state governor, we've acquired the X-ray machine, which enabled us, aside from enabling us get accreditation, it has enabled us offer very standard care to our patients. The hospital currently has 2 digital X-ray machines, with one of them the direct radiography, which is the high end of radiography X-ray machines as we have it today.
At the Mother and Child Hospital and the Advanced Diagnostic Center, Owalero in Ika Northeast, the story of excitement trailed by excellence with the state-of-the-art medical equipment, laboratories and theaters gave joy to doctors, medical personnel and patients because the right equipment and facilities are not in scarce commodity. The Chief Medical Director, Dr. Martins Igbase, describes the hospital as a one-stop shop medical facility with functional endoscopy, fertility center, blood bank, hematology unit, microbiology, parasitology, biochemistry, and well-stocked pharmacy, among other key units. With an average of over 2,000 patients attended to on a monthly basis, the hospital is providing patient-driven care. It is also a training center for medical students of the University of Delta, Abo, and the College of Nursing, Abo. The hospital boasts of a functional oxygen plant, solar-powered systems to power its equipment, thus providing 24-hour uninterrupted power supply. In addition to a 500 kVA generator, ambulances, and a highly motivated workforce with a modern staff quarters. This is the Mother and Child Hospital and Advanced Diagnostic Center, where healthcare is at its peak.
One of the key attributes of this facility is the Advanced Diagnostic Center. The Delta State government has been magnanimous enough to provide quality equipment to be able to carry out diagnostic interventions and procedures for these our patients in Mother and Child Specialist Hospital and the Advanced Diagnostic Center. It's important to the functioning of this facility because without proper diagnosis, treatment options might be limited. The facility is equipped with state-of-the-art equipment, one of which will include a 128-slide CT scan, which has been fully functional and has provided diagnostic services for our patients. We have well-equipped laboratories and also other radiological equipments such as an X-ray, digital mammogram, as well as ultrasound scan machines. Now, it's also important to note that we don't just carry out diagnostic procedures, diagnostic processes, but also diagnostic procedures as well. The center is equipped with an endoscopy machine, which aids in the diagnosis of gastrointestinal problems.
Undoubtedly, the Delta State University Teaching Hospital, Del South Ogara, in Ethiopia West local government area is the first tertiary health institution in Delta State established in 2010. It is a 200-bedded hospital with over 1,000 workforce in different specialties of medicine such as pediatrics, obstetrics and gynecology, public health, ophthalmology, and dentistry, among others. According to the Chief Medical Director, Dr. Nyemeke Simeon Awuno, the hospital, which is a referral center, currently boasts of new equipment such as MRI, CT scan machines, dialysis machines, and a portable echo machine for diagnosis of heart diseases, among others. Aside from donations from the Niger Delta Development Commission, NDDC, which provided mobile X-ray, 2 ultrasound machines with synergy with the Delta State Ministry of Health, geared towards improving health services. Already, work is ongoing for the installation of a CT scan machine in the hospital, which has already arrived in a crate. With a well-stocked pharmacy that distributes drugs and other pharmaceutical products to 4 other pharmacies within the hospital, it provides patients with the best drugs for their treatments. He affirms that DelSouth unquestionably is blazing the trail as a tertiary health institution with several medical breakthroughs. The premises is properly lighted at night, courtesy of the Oborevwori administration. It is witnessing transformation as some massive structures are springing up, with 2-story buildings completed comprising 24 flats each, while others are currently ongoing for house officers and resident doctors, thus reducing the burden of accommodation for staff, while efforts are already in top gear for solar-powered systems.
The state government has also helped in even improving the lighting around the environment. It's a teaching hospital, and safety, health and environment plays a strong role. So if you came in December, you find areas in where the compound, the estate was dark. But through the initiative of His Excellency, the Governor of Delta State, Right Honorable Elder Sheriff Oborevwori, the Delta State University is much more and better lighted. Also with the support and approval of the government, we were able to undergo what we call a mass metering scheme for the whole hospital, helping to reduce the burden immediately on the hospital.
It proudly has a highly motivated workforce which delivers quality healthcare services to the people.
I must appreciate the government for. It might be taken for granted, but you don't hear of any owing of salary. Before the month ends, people are paid their salaries, dues of staff is being paid them. Largely to the government, when approvals are made for increases and other things nationally, Delta State has, to a large extent, always kept faith in being one of the first or early states to implement such provisions. And we also believe that more and more will come. DelSouth has contributed generally to the global world of science and research. On behalf of the Delta State University Teaching Hospital, I want to thank His Excellency, Right Honorable Elder Sheriff Francis Oborevwori, for the support he has given the hospital.
At the General Hospital at Oborevwori in Okpe local government area, the footprints of the Oborevwori administration has taken roots with the construction of a new gigantic hospital, which is already nearing completion as work was ongoing unhindered. The old hospital building was no longer befitting. The General Hospital, Oborevwori, was last renovated 20 years ago. Fixing of tiles, aluminum windows, and other facilities were going on smoothly. It is hoped that when completed, the hospital will be stocked with state-of-the-art facilities. The Central Hospital Warri, which is undisputably one of the oldest hospitals in Delta State, is a 262-bedded hospital that caters for over 10,000 patients on a monthly basis with 160 nurses, 68 doctors, 9 pharmacists, 9 laboratory scientists, and other support staff who help to render healthcare services.
We have a range of specialists, medical specialists, surgical specialists, pediatric specialists. We have some other services, endoscopy services that we render. We have X-ray, radiological services, X-ray machine, ultrasound scan. We have specialist radiologists on hand to render those services. Most patients are satisfied at the end of the day, because when they come in here, they come in needing healthcare delivery.
The Zonal Medical Director, Dr. Olive Ogenero Ogele, applauds the Oborevwori administration for beaming its searchlights to the hospital, as it has provided 3 new dialysis machines in addition to the 2 the hospital had been using, thus making it 5. Governor Sheriff Oborevwori has graciously approved a CT scan machine for the hospital, and the hospital is already preparing the room where it will be mounted.
We are preparing the room, and so once the room is ready, we'll take delivery of the machine. We also have a dialysis center. Previously, we had 2 dialysis machines, but recently we took delivery of 3 new dialysis machines, making the total of 5 dialysis machines, and this will go a long way in improving services to patients in our environs.
The hospital operating theatre will soon be expanded, as officials of the state government have already visited the hospital on an assessment visit with a view to expanding it to meet modern reality. The more agenda is evident in the hospital, with only access road leading to the 2 different gates of the hospital, which had been in deplorable state. It has now been tarred, thus giving visitors and patients a smooth ride to the hospital, while a major storm drainage project to check flooding within the premises of the hospital is also ongoing. The Central Hospital Warri, with functional dental clinic, attends to several patients on a daily basis with modern dental machines. It also has a dental laboratory where dentures are manufactured. The 100-bed Mother and Child Hospital has also given mothers and children super care, as the free maternal and under 5 treatments are going on smoothly, thus putting smiles on the faces of the people. Governor Sheriff Oborevwori administration in healthcare is indeed a silent revolution.
We have opened our Servicom office. Servicom is charged with improving service delivery, so we've opened our Servicom office, and so we're able to respond to patients' complaints more promptly, with a view to improving our services and also ensuring that our staff, they, as much as possible, will try to improve their conditions of service to the best of our ability. We are in the process of linking most parts of the hospital to the solar power. So you look around generally, infrastructurally, around, there are lots of good quality constructions that are going on, and this gladdens the heart of every citizen of Delta State.
The story at the Mariri Memorial Central Hospital, Ughelli, is not different. The environment is inviting, while new innovations have been witnessed within the last 2 years of the Oborevwori administration in terms of modern equipment and facilities. Dr. Valentine Izechi, a consultant orthopedic surgeon, highlights the transformation in the hospital.
Has over the last couple of years undergone a lot of significant transformation in terms of service delivery and equipment and structures. In the last couple of years, from what we met, what has come up now is a hospital that is nearing a standard one, from personnel improvement to equipment acquisition. For example, we can now do echocardiogram, ECGs there, we can do digital x-rays, we can do Doppler scan, eye scan, all sorts of soft tissue scan. We can do barium in an enema, which is very significant. Also moving to structural development, we've moved into a new theater which is very standard now with standard facilities. Theater is now very okay. We have a ward, a wonderful orthopedic ward that is 24 hours light with solar. So we've seen the gradual solarization of the hospital over the last couple of years. So by and large in Ughelli Central Hospital we have improved. Significant changes have taken place, and we hope that with this administration many more changes will take place. But more importantly, we want to thank our very own highly esteemed Governor Oborevwori, who has orchestrated these changes in this place. Indeed, the future is bright for the health sector.
The hospital flaunts its new equipment in the laboratory used for the diagnosis of different ailments. The Mariri Memorial Central Hospital, Ughelli, has a functional eye clinic with Dr. Patrick Ojarikre, a consultant ophthalmologist at the helm of affairs at the clinic. The clinic has modern automated machines to carry out various tests to give accurate treatment. The Zonal Medical Director of the Central Hospital, Ole, Dr. Christopher Ubaja, a consultant radiologist, says the hospital is faring well in delivering its mandate of providing affordable, accessible, and reliable healthcare to the populace. With no bureaucratic bottlenecks, the administration of the hospital comes in handy.
The government have done a lot for us as an hospital. Primarily the ability for them to allow us to generate and spend the funds that we use to run the hospital. To me, I think that's the greatest achievement that that the government has done for the hospital, because it gave us some reasonable degree of independence to run the hospital. And then the government has also done the under-file free care and the antenatal maternal and child care too, which is absolutely free. That has been an outstanding achievement that the government have attained, and everybody is happy about it because lives have been saved and there's nobody dying because of lack of funds.
At the General Hospital Ozoro, the medical director, Dr. Aboye Jennifer, says the hospital has taken delivery of medical equipment, including furniture and desktop computers. The Oborevwori administration recently delivered a 60 kVA soundproof Perkins diesel generator to enhance electricity. The laboratory also has some modern equipment, solar blood bank refrigerator, bucket centrifuge, hematology blood test equipment, solar refrigerator for preserving drugs and vaccines, a brand new hematology analyzer, chemistry analyzer, new beds and mattresses have been provided to make the hospital comfortable for patients. There is the growing concern of health workers who travel abroad for different reasons, thereby creating gaps in government hospitals. How is Delta State coping with the Jagba syndrome in the health sector in order not to jeopardize the Oborevwori administration's policies and programs in the sector? The Oborevwori administration is doing everything possible to address two issues of brain drain and manpower shortage by investing in the welfare of doctors, nurses, and other health workers.
His Excellency, in his good wisdom, approved the standing order for doctors and nurses who are exiting the service, either by retirement or by resignation, to replace them immediately. And that has really helped our human resource for health in great deal. But with this approval that His Excellency approved for replacement of doctors and nurses, that have really reduced the effect of this Japa syndrome.
A motivated workforce can go to great lengths without being compelled. As the saying goes, motivation isn't just about getting the job done. It is about doing it well, with impactful and measurable results.
Right Honorable Sheriff Oborevwori, the governor of Delta State, is doing excellently in healthcare, I must say. Yes, Delta State is the highest paid, even more than federal government, in terms of remuneration to their healthcare workers. His Excellency, in his good wisdom, did it so that we can retain the health workers we have who are ready to stay behind. So that's what we did. Like of recent, they approved the tax rebate for doctors in the state, meaning that their allowances will not be taxed. They are exempted from taxation. So that improved their salary more than federal. As I'm talking to you now, over close to ₦1 million, 951,400, have been approved to all resident doctors in the state. As I'm talking to you, approval have been granted. Is in the process. In the next 2 weeks, they will prepare their funds. So the state government is doing a lot in terms of remuneration to health workers in the state.
The Oborevwori administration is equally firm on discipline. Everyone is expected to play their roles diligently and responsibly in order not to jeopardize government efforts in the health sector. What more are Deltans expecting?
Yeah, if by 2 years we've gone this far, I believe by the next 2 years, Deltans will see the improvement is visible to all. You know, healthcare majorly is not infrastructure. Healthcare majorly is social good. When people come and they get treated, they come for free maternal, they get their care, the minimum, they have minimum challenge. That's when you know that the healthcare is. And at the end of the day, it paid back with the indices, the health indices in the state, like reduction in maternal mortality, reduction in under 5 death. So those are some of the things that will speak within the next 2 years.
The Oborevwori administration is walking the talk in providing affordable and accessible healthcare with the state-of-the-art equipment. Clearly, the governor has demonstrated this with various health infrastructural projects.
The specialist hospital in Oborevwori is at top gear. A lot of work is happening there. That hospital will accommodate a new college of nursing and midwifery, and also the public health lab. We don't have any in the state.
Delta is not only making headway in health, the Oborevwori administration is blazing the trail. It is a new era in healthcare in Delta State. With just 2 years on the saddle, Deltans should expect more.